our morning panel to discuss social isolation and mental health. Our moderator is Connie Weaver, Treasurer of the NCOA Board and Chief Marketing Officer at Equitable.
Good morning, good morning. I know we're putting more chairs in the back. There are also chairs up front. It is so wonderful to see so many of you here and ready to go. Wasn't yesterday amazing? I have to just give a round of applause for all of our speakers and everything. It has been just such an amazing week, and we're kind of right in the middle. So this morning, we're going to take on a topic which is important to everyone in every aspect of what we do. And that really has to do with social isolation and mental health. You know, how people feel, how they react. I heard it in so many sessions come up one way or another. So it's got implications for literally every single thing we do. And we put together such an incredible panel. Let me start with Megan Wolfe here, who's in the middle. And Megan is a Senior Policy and Development Manager of the Trust for America's Health. Andrew MacPherson, founder and Executive Chair of the Foundation for Social Connection, quote, the Action Network. And of course, you all met yesterday Tori Strawter-Tanks, who is our Trailblazer Award winner this year and director of the Clayton County Service Department, and much, much more. The other thing that was so heartening is when we went around the room yesterday, so many of you are practitioners. You're boots on the ground. You're in the game every single day. Many of us influences, many of us invent ways to facilitate us, all of our wonderful vendor partners that are here with us, but so many of us are boots on the ground. So our goal today is to define and really help this topic be framed. It's somewhat misunderstood sometimes, often misdiagnosed, and probably under-addressed. As a matter of fact, I remember reading some of Tori's work saying that she equates this to the catastrophic issues like obesity and smoking and other issues that affect health, mindset, and well-being. And in this environment and with the spirit of aging to be your best self, I mean, it's just incredible to think about how we're addressing so many of the interrelated issues that we face in order to help achieve that. I'm going to just I always like to frame things with a few facts. And so it's always interesting to me to go to population. And so I was thinking a lot about the fact that this is the first time we have, let me go back one here, 6 generations, literally 6 large generations that are all coming together. The interesting note that we focus a lot on in financial services is that this year, in 2025, we call it Peak 65 because it is the peak of the boomers turning 65. And there are now about 72 million of them. And so they're matriculating into various phases. I call it encoring, by the way. I hate the word retirement because I've failed 3 times. We're going to try again this year, but whatever. But really matriculating into that next chapter. And that chapter has so much to offer around life, purpose, benefit, giving back, impact, and all the things we hope to achieve. But what's really interesting is if you look at boomers, 71 million, you look at folks that are, you know, what we used to call the silent generation, they're not silent any longer, between 80 and above, you've got, in 2030, when boomers matriculate, you'll have 94 million people in that zone. That is a greater number than has ever occurred in the life of this country. And for the first time, outstretching some of the younger populations behind it. And of course, it goes without saying that women are living longer, so as time goes on, the percentages move from 50-50 to more of a 65%, split to women. The other thing I just wanted to note, because it was a really interesting stat that sort of brought it home for me, my mom just celebrated her 100th birthday 4 weeks ago. That's pretty cool. Now, my father-in-law is 102, so I figure we got good genes going for us. But I looked at this, oh, let me go back here. I'm doing a terrible job as slide driver today. A picture's worth 1,000 words. If you look at the last 50 years, the number of people turning 100 centurions has come along. But in the next 25 years, it will quadruple, and there will be over 400,000. Now think about that. That's just tip of the iceberg, because if you think of all the healthy living in the population behind it, that foreshadows what we will look like in terms of a country and the impact we can all have. So with that aside, I'd like to now move on to my panel, and this is one of my favorite graphics because it really puts things into perspective. It's what it's all about. It's the confluence of, I'm taking my hands off this button, and I'm not touching it again until Andrew's slide needs to come up. But if you look at it, it's the confluence of financial security, which is the space that I live in every day, financial well-being, healthy living, which I know Megan spends tons of time there, as we all do, safety, which I've recently added to the bubble because it's becoming such a pervasive element for us, and of course, community engagement. And all of this is wrapped, if you start to think about it, in our topic today around social isolation, mental health, loneliness, all of the elements that go with us. So that's where we're going to focus. And, it's a big topic. And when I first, started to think about the panel, I kept saying, well, is it chicken egg? How do I think about mental health over here? It's a big topic. Social isolation over here. So, Andrew, we're going to start with you because frame this conversation and put it into perspective for all of us in the room for the conversation, please.
Absolutely.
And if you'd like me to touch the button,
maybe I'll take the, no.
Because that's yours coming up next. There we go.
No, it's the perfect tee up. First of all, I want to thank National Council on Aging and your leadership and your government affairs staff. Just extraordinary work happening at NCOA. NCOA was a founding member of our coalition back in 2018. They were ahead of their time. They took this issue on, and they continue to take it on today. And I want to thank each and every one of you in the room as well. It goes without saying, these are tough times. Tough time to age in this country. The downstream effects of what's happening right here in Washington, D.C., we're feeling already in this country. And it's moments like this and rooms like this and organizations like this that allow us to stick together, to be connected, and to make change. So I want to say thank you to NCOA and all of you. So yeah, my name's Andrew MacPherson. I founded the Coalition to End Social Isolation and Loneliness in 2018. Why? Well, there was decades of extraordinary research on this issue, looking at not just the health impacts, but the impacts on our communities across the country, impacts on people of all ages. The academic community and the research community had really stepped up, number one. Number two, markets were beginning to change. Health plans were beginning to innovate. The private sector was starting to step in and develop solutions. We see some of them now in the back room here. Well, guess who wasn't engaged? The United States Congress and the executive branch. So in 2018, we came together with just 15 organizations, Connie. We're now 70 national organizations involved in our work, and I couldn't be more proud of that. So let's talk about definitions as we start to frame the issue together on our panel today for just a second. Loneliness is a subjective measure, I think as many of you in the room know. It's a subjective, unpleasant or distressing feeling of a lack of connection to other people, and a desire for more satisfying relationships, okay? So it's inherently a subjective measure. Social isolation, on the other hand, is an objective measure. It is referring to have objectively few social relationships, social roles, group memberships, and infrequent social interactions. So you can be married and be lonely, okay? Social connection, switching to the positive, really means having a variety of really meaningful relationships that you can rely on, okay? So these are the terms that we're going to be talking about in our panel today and sort of set the stage for our discussion. This is, when you start to look at the prevalence of this issue, it's absolutely astounding, and we have to remind ourselves of what's going on in this country for the people that you serve every day, but also our youth. Recent surveys have found that approximately half of US adults report experiencing loneliness. A full half, 50%. The highest rates are actually among young adults, according to a whole range of studies. This truly is an epidemic. As we know, Dr. Vivek Murthy, our former Surgeon General, really took this issue on, has been an incredible leader. He was just on Meet the Press last Sunday, still talking about this issue. It is a public health epidemic. I know that that is a technical term, but we are, that is the situation we find ourselves in. About 30%, just under 30% of community-dwelling Americans who are 65 and older are considered to be socially isolated. About 43% of adults 60 and older report feeling lonely. As we know, it is linked to a range of chronic illnesses, okay? 50% increased risk of dementia, 29% increased risk of heart disease, 32% increased risk of stroke. These are huge numbers, folks. We have no choice but to take this issue on, and everybody in this room has a responsibility to do so. And I think our goal with the panel today, Connie, is really to talk about not just the problems, but also the solutions. And I love this social framework slide. So our organization is a 501c4, meaning we really focus on advocacy, lobbying, educating the Congress and the executive branch. But we have a sister organization, the Foundation for Social Connection, which was launched in 2021, that is really focused on research and programming. We have the backbone of the Foundation for Social Connection, the C3, is our Scientific Leadership Council, which is led by over 20 of the leading academic voices in this country, chaired by Dr. Julianne Holt-Lunstead. And this social framework is what they came up with over the course of several years of work together as a unit. This is the extent of the ways that social isolation and loneliness and social connectedness impacts society. It's not just health, okay? Health, the workplace, education, the environment, housing, transportation, nutrition, leisure. Raise your hand if you in your work every day don't touch one aspect of this social framework. Okay, there's no hands in the room. We all have a responsibility to take this issue on, Connie, and to really focus on all these different aspects of how to address this very complex issue.
Absolutely, thank you. Thank you very much. Megan, let me turn to you, and from your lens, you sit in that chair, you focus a great deal on health, although you did tell me that your title really doesn't reflect your focus, so we gotta understand what that means relative to this topic. But take Andrew's framing to the next step from your lens, from the health perspective.
Absolutely. Thank you, Connie. Like Andrew, I'm really honored to be here with all of you today and hope I can provide that public health perspective, but also help to give you some ideas of how you can connect with your local public health departments to help address some of these issues. So from a public health perspective, as you said, the Surgeon General in his 2023 report called social isolation and loneliness a public health crisis. And we agree, and those in public health agree and really want to tackle this issue in partnership with all of you and other community actors. So just another level of public health data. Yesterday, TIFA published our 2025 Pain in the Nation report, which shows that there's progress being made on alcohol, drug overdose, and suicide deaths. There's progress being made in every demographic except older adults. So across the board, suicide rates are going down about 10%. For older adults between 55 and 74, it went up 4%. And for those over 75, it went up 9%. So we need to do something. We need to act. I love the coalition that you're leading, the foundation, just doing some amazing work. We all need to do this together. From a public health perspective, public health departments love to work in concert, in collaboration with, as I said, with AAAs, with other community-based organizations. There are a lot of really interesting, innovative models that are happening that are being led by public health departments. And so I think we'll get to some of those later. But I love this framework because it really is an ecosystem. And we're going to talk about the ecosystem also in a little bit, but it brings together all the different aspects of sectors that touch on the lives of older people and points to a lot of opportunities for collaborative work together.
So while we have this up, why don't you talk about the ecosystem now?
Okay.
Talk a little bit about, how this audience can really participate in taking action around your ecosystem framework, particularly with your report just coming out, et cetera.
Sure, thank you. So we consider the age-friendly ecosystem as a network of practitioners, providers, organizations who are all prioritizing the quality, an improved quality of life for older people, for caregivers, and for their families. Right now, we consider the ecosystem age-friendly public health, age-friendly health systems, which commit to the 4Ms framework in their hospitals and health systems, age-friendly communities through AARP, and who here has been part of that AARP built livable communities? Yeah, so several of you have. Great partners. Also universities, age-friendly universities, and then home and community-based services, which of course you are all part of. These are all part of the age-friendly ecosystem, which are beginning to work together and create plans together to improve the lives of older people. I'll give you one really cool example, and that is the community health improvement process. So this is a process that local health departments have to go through every 3 to 5 years. They are required to bring in other community partners, whether they're agencies, nonprofits, for-profits, hospitals. They all come together, they do assessments, they do surveys, they bring in older people themselves to identify priorities in communities. And I will tell you, many of them are looking at social isolation as a priority in their communities. But they're not just identifying problems, they're working together to find solutions. So I would say, look to your local health department. You asked Connie for what people can do. Look up, look around, find out who's doing what, who's doing those community health assessments and who's involved in the community health improvement process. And then also, if you're at the state level, your state may be involved in developing a multi-sector plan for aging, and those MPAs can also be a tool for this age-friendly ecosystem multi-sector collaboration.
Great. Tori, let's turn to you. I call you boots on the ground because you are in it every single day and covering such a spectrum of issues, opportunities, et cetera. So when you step back and you think about this topic and what we've just defined, what comes to mind for you and what is in the minds of so many people here in the audience? How do we start? And then we can talk about how we solve.
Yes. So I am truly honored to be a part of this panel, and I'm so grateful and thankful to NCOA. The work that you do is absolutely amazing. It has totally shifted my mindset about senior centers, the aging process, how we connect, and how we navigate in the world of senior centers. So every panel that you see me on and every time you hear me talking, I am going to be talking about the impact and the power of senior centers. So when you look at this social framework, there's not an area on here that senior centers do not touch. I consider ourselves senior center professionals, and we're the real superheroes in the room. The work, yes. The work that we do is absolutely amazing. Wisconsin Association of Senior Centers has this quote that says, if you've been to one senior center, you've been to just one senior center. Senior centers should reflect the communities and the neighborhoods that they're in. What I'm finding is a lot of people have no idea of the work that we do. I'm preaching to the choir because all of us know the impact of the work that we do and how this work directly impacts social isolation and loneliness because we're in it every day. We see lives being changed. We see people learning new skill sets. We see seniors actually volunteering, working, and just doing absolutely amazing things. So for me, my passion is around making sure that senior centers remain vibrant, they remain active. We must figure out a way to tell our story so people really understand the impact of senior centers and how they address this issue. So people keep saying, Tori, you act like senior centers are the panacea to everything. In my mind, they are. They are. They are. I believe in senior centers, I believe in the work that we do, and I will spend the rest of my career just talking to people about senior centers, the work that we do, the impact that we have, and how we can really address this issue.
And the way you make people feel, such a huge part of even addressing this topic and other related. And I love that the fact that you brought up storytelling. So later on, we can get a little bit into that storytelling and how storytelling can help amplify our needs, our causes, et cetera. So we'll save that for a little bit later. Now what I'd like to do is move to a new topic. And that topic started on Monday with over 100 of you going to the Hill. Thank you for sharing your voices. Thank you for educating, because the force going to the Hill, your conversations enlighten the people who are setting the frameworks for policy, et cetera. So keep it coming, don't ever forget. So with that, I have, when I think about testifying and using our voices, recently Andrew and Tori both had the opportunity to testify in front of Rick Scott, Senator Rick Scott and Tina Smith's panel, which really focused on social engagement and network initiatives related to the Older Senior Relief Act. And very, very important. As a matter of fact, Senator Scott focused a lot on loneliness, adding it to the definition of disease prevention and health promotion services under the old act, expanding definitions, which I think is a really good step in the right direction. So, Andrew, let me turn to you first, and could you share a little bit about what your key messages were and how those messages can be shared both among this audience, but then taken beyond the doors of this hall?
First of all, bipartisanship, despite what you read in the news, is alive and well on this issue. Okay?
And isn't that a good thing?
Yes, it certainly is. Yes. Chairman Scott, Rick Scott, a Republican from Florida who was in the running to be...
My district, by the way.
Oh, wow. Who was in the running to be actually the majority leader in the Senate. He lost out to Senator John Thune, but not by many votes. You know, a pretty powerful and influential Republican wrote a bill that Connie was just referencing with Senator Tina Smith from Minnesota, a relatively progressive member of the Democratic Party. Senator Raphael Warnock also joined that legislation. So Chairman Scott we were very appreciative that he held a hearing and that we were asked to testify in March. We had like 9 or 10 members of the Senate show up, tell personal stories, talk about seeing constituents and the effect of loneliness, especially in rural parts of the country. This was kind of an extraordinary moment, especially given the hyper-partisan environment that we find ourselves in now. Well, guess what? There's 7 other pieces of legislation beyond the Senior Act that Chairman Scott and Senator Smith and Senator Warnock introduced on all different aspects of this issue that were introduced in the last Congress with our support and other support in this room, okay? Almost all of the legislation is bipartisan, almost all of it. All of it is bicameral, meaning it's been introduced in the Senate and in the House. I'm optimistic on social isolation and loneliness, I really am. And I'm optimistic because of people like Chairman Scott, you know, holding hearings like that, the Senate Special Committee on Aging has no legislative authority, okay? So the committees in Congress are where a lot of the really hard policy work and the heavy lifting is done in terms of actual public policy and legislation. The Senate Special Committee on Aging does not have legislative authority. However, it does have the ability to raise the visibility in Congress of key issues affecting older adults. And in this case, Connie, I think it was a really successful moment to have Chairman Scott coming forward with Democrats and Republicans saying that now is the time to take this issue on from a political and policy perspective to help older Americans in need.
I think that is amazing. And Tori, you were there too. You were representing many of the voices in this room, again, where the reality hits every single day. Some of the challenges that we all face in funding and things like that. Why don't you share some of the points and storytelling that you made during this testimony?
Yes, it was an amazing opportunity for me, again, to talk about senior centers and how I feel like senior centers address every issue as it relates to social isolation and loneliness. I spent a lot of time talking about the Older Americans Act and how most of those services are funneled through senior centers. Like 60% of the OA services, we touch those some kind of way inside a senior center. I talked about the impact of how senior centers have changed seniors' lives. We have a senior in our county that went on to be a famous superstar actor, and I think telling stories like that makes it more personable and real for legislators to understand the work that we do. So it was really important for me to really tell the story, drive home the impact of OA and how it impacts seniors, how it impacts our state, and how it impacts all of us in our senior centers and the work that we do.
There was one negative aspect of the hearing. I had to follow Tori.
Well, hey, a tough act to follow any day, but I'm sure you both just soared. Megan, any thoughts from you? You are a big proponent of storytelling, you know, especially bringing in your lens from health policy, et cetera. Just any comments you'd like to add to the narrative here?
Sure. So from a public health perspective, of course, we like to share the story of data, like those data points that I shared with you a few minutes ago. But sometimes if you're sharing those with a member of Congress or any policymaker, right over their head, right? So that's not necessarily going to resonate. It's important, maybe more for the staff than the legislator. But the personal stories where you make yourself vulnerable, you know, my mother had a fall, and she ended up dying 6 months later. True story. And those are the kind of stories that will resonate with people, because we all have someone in our lives who is struggling, whether they're a caregiver, whether they're an older person, whether they have a grandparent, trying to find caregiving, you know, trying to find services. Everybody has this, you know, has this going on in their lives. And so I think to the extent that we make ourselves vulnerable and we can share our own personal stories, that's going to resonate.
Andrew, one wrapper around this is with all the change going on in Washington, particularly what's happening with HHS, the Health and Human Services changes, uncertainties, et cetera. Any concerns or any way we think about risks to changing direction, funding, things like that, relative to this topic? How does it play alongside of all of this?
I'm not going to sugarcoat it. It's a really difficult time. Organizations like NCOA, our organization, the Foundation for Social Connection, TIFA, we exist for moments like this, okay? We are doubling and tripling down on mission in our work at the foundation and the colleagues that we work with at 70 national organizations that participate with us. This is when mission is most important. They're planning to cut or are cutting about 30% of the HHS funding budget. As we know, ACL, I'm sure it's been a hot topic over the past day and a half, is being folded into, to some extent, we're going to find out how this goes, into the new Agency for Healthy America. There are a smaller and smaller number of people at the very top of the department and the agencies that are left that are making all of the decisions. Your voice matters now more than ever. We can put a halt to this. Now, nobody is going to suggest that there wasn't some waste in the system. Nobody's suggesting that. This is not the way to do this. And our voice and your expertise, boots on the ground, are critically important right now to help shape what federal funding is going to look like in this country over the next decade or longer. That's the harsh reality. But I think that there's hope. This issue and many other issues in aging are bipartisan. We were just talking about personal stories, okay? Personal stories do cut through the political toxicity. They just do. Everybody that's in a position of power in this city, Connie, has a personal story. We also have data, and we've got mission, and we've got all of us together. We have to double and re-triple our efforts to protect funding, to protect care, and to protect every single one of you that's providing those services across the nation.
And if I could add something there.
Sure, Megan.
So we consider healthy aging right across the life course. So it's, it's really, the Older Americans Act funding is crucial, so crucial, but so is prevention funding. It's like we have to support ourselves and our families, all across the life course in order for us to be healthier when we get to be 70 and 80. So that's what TIFA is doing. We're out there pounding the hill as well on trying to protect the funding for the Prevention and Public Health Fund, for CDC, for all the funding and all those programs that protect all of us all through the aging process.
Well, and when I think of the quadrupling of the centurions and the population behind it, that underscores the data you talk about. This is putting the stories to the data, and every single member of the Hill has those personal stories, but they may not have connected the dots. And what we can do is shine a light on where they can connect those dots, and that's the power.
Can I give a specific example, Connie?
Well, I think Tori wanted to.
Oh, sorry. Yeah.
Yes, I think it was an interesting conversation yesterday about ensuring that the seniors that we serve understand that the funding for the services that they are getting come from the Older Americans Act. And I think that in our senior centers, we need to do a better job of explaining that. I know inside our senior centers we do. I do a Let's Talk with our seniors. I explain to them the funding process, where the funding is coming from, so they can be connected and they can advocate for themselves. So I think it's very important that we include that in our senior center programming. We make sure that it can be an OA 101 class or something, just so they know, so they can advocate for themselves, because I think that's very important.
Congressman Mike Flood, Republican from Nebraska, the 2nd district, light red district. He won by 20 points, Republican. He came to this issue because during the pandemic, he was realizing that older adults were experiencing extreme loneliness, and he actually learned about it through the Postal Service. So think about the connectivity here. He was meeting with the head of the Postal Service in his state, and he said, my postal workers, they might be the only social connection that some of these people have each day, and it blew his mind. He's now introduced bipartisan legislation, Connie, and is advocating for this issue on the Hill. So these personal stories, they do cut through, and we can, really neutralize a lot of the political challenges that we're facing in this country if we really, rely and focus on them.
It's all about connecting the dots. We're on a huge topic with loneliness, social isolation, mental health, but it touches everything. And so I do think I take that. As a matter of fact, I'm going to tell a little personal story to introduce the next topic, and we'll quickly kind of go through this. You just brought up the pandemic, COVID. My mother was in an assisted living, who now is 100, but I didn't think she was going to make it through. She was locked in her assisted living place. She, had her little apartment, but wasn't allowed to go outside. They couldn't socialize. She didn't exercise. I saw a level of deterioration that blew my mind. Now she's come out of that, and we've worked hard to do it. But when I think about my personal story and what I saw, you can read about it, but when you watch a loved one go through it, it's pretty mind-boggling, just like your colleague, or just like the observation with the Postal Service. So, Tori, I'm going to throw this one over to you, which is not that we're going to dwell on this, but what have we learned from coming out of this? What are the changes, especially relative to loneliness and isolation? What are the things that we've learned, the lessons we can take forward, and the things we can share that are profound for maybe not the next pandemic, but should be best practice?
I think we learned a lot about technology and how Zoom calls and all the various things that we had to do to make sure our seniors were connected during the pandemic. As a matter of fact, we're still using those. So now we call it like a hybrid method inside our senior centers, because we have seniors who may not be able to get to a senior center just because, they have other things going on. So I think the pandemic really taught us about our operations as it relates to senior centers, how we operate our emergency plans. The NCOA put out an amazing manual to help us navigate through the world of COVID, and so we're still using those. So I think it's important for us to be forward thinking and really look at technology to bridge that gap. I know there's a huge digital divide between the population that we serve and actually what's going on, but I think the pandemic really showed us that our seniors are capable of transitioning into technology. Some of them had no other choice but to learn how to use Zoom. It caused us to make sure that we were teaching more technology classes, which we're actively doing, and I think across the United States, most people are doing more technology classes inside their senior centers, so it really pushed us. We knew the digital divide was real, but we weren't really aggressively attacking it, but because of COVID, it's pushing us to make sure that we shorten that gap between the digital divide and our seniors.
We've got a great panel tomorrow morning. I hope you guys take advantage of it on technology and coming out of the technology industry. It can be friend or foe. There are lots of nasty things going on, like fraud and things like that, but there are a lot of wonderful innovations. As a matter of fact, I hope you take the time to visit with some of the folks here that are exhibiting that really have some interesting solutions. Like Sony, for example, a new comer to us this year, and on hearing devices. My deceased husband lost 75% of his hearing, another story. I saw a man who was always the middle of the conversation just retract because he just couldn't hear when in a room full of people. Technology is changing that. So it's not just connection, it's all kinds of ways. LEQ was kind of an interesting one if you haven't seen it. And of course, our trailblazing partner, AT&T, is doing some amazing things. Just to name a few, there are others. So that conversation tomorrow, I think, will be a very good one, and I think that there are ways to explore as you go into it. At any rate, moving on, I'd like to change the topic to that notion of caregiver a little bit. Now, caregivers come in many shapes and forms, and we've heard from many of them over the course of these last couple of days. Often, the layperson thinks of that person that comes every day and helps. But in reality, so many organizations provide caregiving. You just mentioned the post office, and I hadn't thought about that during COVID. Someone who can observe and maybe the only human contact. Meals on Wheels, we heard from them yesterday. And if you think about it, when someone comes to the door and then all of a sudden Aunt Millie doesn't answer for a couple of days, that's a line of first defense about, is there something wrong, something happened, is somebody retracting and isolating? There are many, many social organizations that are doing so much good, and I know, Andrew, you work with many of them. We at NCOA work with many of them. So let's talk a little bit about caregiving and really frame this. And I think, Tori, I'm going to start with you a little bit. Again, first line of defense, partnering with caregivers. How you think about caregivers who are often overworked, but are critical partners with your organizations, et cetera. Frame that a little bit in terms of that front line of defense and often the most important line of detection. And I'll tell one more quick personal story with my 102-year-old father-in-law and his caregiver, Justin. When Justin's with him, and Justin's like 30 years old, I love this generational, he becomes playful, he becomes alive, he gets up, he wants to move, he has conversations. And it's like he's changed. But when Justin has his days off or doesn't come for a while, I see him start to detract. Maybe those are the days he doesn't want to get out of bed. And when you see it, when I've seen it, you start to truly appreciate the impact, but also he helped us as a family understand what was happening, which we wouldn't have without Justin. So the value of these caregivers is just enormous. And again, stories and things like that, especially on this topic. Tori?
Yes, I think I have a slide, a picture.
Oops.
Yes,
Oops, I am failing slide.
it's okay.
I don't know. I am just failing. There we go. Wait. Okay. You talk, I'll get us there. There we go.
So the role that senior centers play with caregiving can be vast. You can have a mother and a daughter inside a senior center. You can have a father and a son inside a senior center. You got to think about we're serving 50-year-olds, 60-year-olds, 70-year-olds, 80-year-olds, 90-year-olds, and now centenarians, right? However, this picture right here is a real picture. This is Janet Tyree and her brother David Tyree. David Tyree has Down syndrome, and she was looking for a place to go so she could recreate with her little brother. She was doing the Parks and Rec thing, and our Parks and Rec department is amazing. However, some of the activities were not conducive for both of them. She found out that our local senior center, because she meets the age requirement, although her brother does not, they still could become a member of the senior center. So Janet and David are now active members of our senior center. David is flourishing and thriving. He's about to celebrate his 50th birthday. He has new friends in the senior center. It is a collaborative effort. So caregiving and the role that senior centers play is very important. It's massive. It can be all over the place. Like I said, it could be aunt and uncle in there in the senior center recreating and enjoying programs together. So senior centers play a vital role ensuring that caregivers get what they need.
And I want that T-shirt.
Yeah, that's.
I love that T-shirt, I know. Andrew, I loved the story you shared about your mom. And Andrew's mom inspired his career in many respects. She was an amazing volunteer for hospice and worked across generations and saw so much. And that inspired some of the work that Andrew is doing in the Action Network. As a matter of fact, I understand you just released, or the Action Network just released, the 2025 to 27 federal policy priorities, which we're going to share with our participants as a resource. There will be resources at the end. We always leave gifts at the end of these sessions. So tell us a little bit about that and how your mother, a caregiver, maybe at the end of life, but a very important moment, inspired your work.
Well, we only have 18 minutes left, but
I know.
And by the way, it's too early in the morning to cry and get emotional. So,
Okay.
My mom's an amazing woman. I was just with her. She's 84 years old now. Talk about social connectivity. She's got friends all over town. We testified with the CEO of the YMCA of America. She goes to the Y 3 days a week. I mean, she's busier than I am. And it is a real testament at the place that she's at in her life about the importance of social connection. Her life's work she's been a hospice advocate and volunteer since there was a Medicare hospice benefit. So 50 years now she's been involved with hospice. She was at the bedside when Elizabeth Kubler-Ross, one of the founders of the hospice and end-of-life movement globally, died. She's just an extraordinary woman. I've dedicated a big chunk of my career to supporting not-for-profit hospice programs and to ensuring that we align people's goals, values, and wishes with how the healthcare system takes care of them as they age and near the end of life. So what does that have to do with social isolation and loneliness? A lot of things, it turns out, which is sort of the direction my career has gone in the past several years. One, there are unique circumstances as you near the end of life, not just for the person, I'm not using the word patient, for the person, but also for their family, I think as a lot of you in this room know, with respect to isolation and loneliness and the impact of grief and pre-grief and the emotions that go along with death and dying, number one. Number two, look at the hospice volunteer program. That is required by statute, right, to be able to participate in the benefit. Couldn't hospice volunteer programs be a great solution and structure to build from to address social isolation and loneliness? This is, when you go back to the social framework, like this is the connective tissue that we think about at the foundation of how to leverage different aspects of our community-based systems, things like hospice programs, health systems, et cetera, schools, parks, the arts. The creative arts plays a huge role as a solution to isolation and loneliness. But couldn't, just as one example, we could write legislation to have not-for-profit hospice programs or other hospice programs in this country leverage their volunteer programs to address isolation. It's another form of caregiving. So yes, obviously very proud of my mom, but also more proud of the work that she's done and inspired across the country to leverage different structures that are already in place to address isolation and loneliness.
Megan, any thoughts you'd like to share on caregiving and the impact here?
Yeah, thank you, Connie. I always have thoughts. Those of you who know me know I always have thoughts.
I'm confident everybody here always has.
So one thing that I did want to bring up that I don't think anybody, so when we're talking about caregiving, is that caregivers can also experience loneliness and isolation. I'm a caregiver. I know many of you probably are as well. And sometimes we just don't take the time to make a life for ourselves apart from our caregiving role.
Sandwich generation.
Yeah.
It's gotten really big.
It has. So something to keep in mind. But I did want to share also a couple of innovative solutions that
I love that.
That we're aware of. So we did a lot of pilot work in Florida for our age-friendly public health system work, and we learned of one really cool program, and they're now doing it in Tennessee as well. And it's called Grandparents on the Bench. And I mean, I love the name of it, right? Just right off the top, Grandparents on the Bench. So the local health departments work with their AAAs and other CBOs to find volunteers, older people, who would be willing to sit at a bus stop, bench at a bus stop, and interact with the kids who are coming to the bus every day. And over time, they develop a relationship, and it gives both the older person and the younger person that opportunity for that intergenerational connection, which I think is very cool. There's another really interesting program at Middle Tennessee State University, and I think this is probably going to expand. And anybody here from Tennessee? Okay, awesome. They're doing amazing work with their age-friendly everything in Tennessee. So at Middle Tennessee State University, they have what they call their Positive Aging Consortium, and this is a multidisciplinary group of experts who have come together and provide programming for older people. They actually go into the community and bring people to the university, to activities, and because it's multidisciplinary, there's all kinds of different things, from the arts to music to history. It's kind of like the OLLI programs that are at a lot of other universities, but what's different is that they actually do go into the community and find people and bring them in to help keep them bring them into engagement and keep them engaged. So a lot of good stuff happening out there.
There are so many great ideas occurring. I'm going to share one from my lens, from the financial area. So many people have difficulty talking about their finances. Many of them don't fully understand them. And so financial education, bringing people together to have those conversations, to really think about what are the conversations and making it intergenerational. One of the tools that is going to be in the resource guide is what we call the family letter. It's kind of a love letter to your family, but it really talks about the way you feel, and it opens up the conversation of money and needs and what matters to you and legacy in a very, very friendly way, fostering dialogue. And again, people, when they're not confident talking about conversations, giving them tools, giving them the help, and you all know this, can open up dialogue and also open up connection. And it's so much about connection. We're going to move, we have 11 minutes, and we're going to move to more the last couple of questions. And I like to put this up because it reminds us of everything that wraps. I mean, this truly is, Megan, to your point, the ecosystem. And actually, Andrew, I really like your ecosystem. I might have to get rid of this one and sort of borrow yours for a while. But moving there, I want to ask a question that says, what is it that keeps you up at night? I mean, we've talked about a lot of solutions, a lot of opportunities. What did we miss here And what keeps you up at night? I'm going to start with you, Andrew, and we'll go right down the line and end with Tori. What is it?
Look, it's the things that keep you up at night are also the things that can drive you during the day. And in my case, and I know we've talked about this for so long, but I still think it's a major, major issue, which is stigma. And stigma is also a really complex, symptom of this social isolation and loneliness challenge, crisis, epidemic that we're facing in this country. And there's a lot of different ways to address stigma, as we know. This conversation is one of them. But what scares me the most about stigma is it's so deeply personal. And until we really reach people in their hearts and in their minds and in the safety, I love safety, by the way, Connie, of their home, wherever that is, setting, and their family, and really know that it's okay to think about these issues, to talk about them, and to ultimately address them, I don't think we'll ultimately solve the problem. That being said, I think that there's just an enormous amount of work going on across the nation to address stigma. But conversations like this start to chip away at it.
Megan?
Yeah, first, to address the stigma, shout out to our friends at the National Center to Reframe Aging, because they're doing an amazing job at reframing how we think about and talk about older people. I'm not going to say that this really keeps me up at night, but it does drive me during the day, is to think about who are the people that we're trying to reach. And I think we don't know what we don't know. We need more research. We need better data collection. We need more solutions, and we need to get the message out about those solutions. And some of them don't cost any money. Like the grandparents on the bench, it really doesn't cost any money. We talk about funding, so important. But there are some things that we can do that are free, and that we can just come out of ourselves and kind of look around, as I said earlier, look up, look around, see where the gaps are and where we can begin to fill them.
So Tori, what keeps you up at night and what gets you going in the morning? I'm going to give it the twist because these guys did.
That is a very loaded question in the realm of senior centers. Right now, it's rural senior centers. I think rural senior centers probably experience more social isolation than any population. There are difficulties with transportation and how they get to a senior center, and just resources are very limited. When you think about Older Americans Act funding, sometimes the trickle-down effect to those rural senior centers, the funding is not as robust. Trying to figure out how we can engage and help those rural senior centers get what they need so seniors can be active. And of course, male participation in senior centers. Women are out participating men in senior centers astronomically, and it's causing a problem in senior centers. Women want men in the senior centers.
Well, there you go.
I love that.
I love
It's a real problem. It addresses social isolation. They're lonely.
Well, and they're outnumbered too.
Yes.
But as we really sort of bring this all home, and it's been an incredible dynamic conversation. We've touched so many things. And I love the suggestions, the solutions, the education. But I'd really like to end with the last question. And I was going to say, give me your best idea for something someone can take away and go do. But I'm going to do it a little differently. Your best idea includes a call to action, because this is all of ours. And at the end, we're going to share some resources and whatnot. But I want to go down the line, and this time we're going to start in the middle with Megan. So we're going to go around the circle. And really think about, through your best advice, what's the call to action here? This is an enormously powerful group. What can they go away, take away to address this and to drive the change? What's your best advice?
My best advice is that we can't do it alone. Like, I can't do it alone. Oops. Andrew's doing great work, but can't do it alone, right? And so none of us can do it alone. Tori, you're doing an amazing job, but you don't do it alone either. So we can't do it alone. So, grab your friends and neighbors, grab your colleagues, look around your community and see who is doing what, and get engaged. Fill the gaps, like I said before. We can't do it alone.
And educate, educate, educate. I have to say I'm struck by the example of the postal carriers, and that no one can, that story really has impact. So those stories sit in front of all of you. Discover them. You have jewels sitting there. Mine them. Tori.
So late at night, I always get these real crazy ideas, and my husband is looking at me like, what are you talking about? So one night, I was like, why don't doctors prescribe senior centers? He was like, okay, Tori, you're just kind of out there. But I think senior centers need to be prescribed. It is a RX prescription. I think we need to do a better job of working with doctors. And when a senior, I know my mom has a really special relationship with her doctor. They talk about everything, but I wonder, does the doctor ever say, have you thought about joining your local senior center? So I just think that we need to do a better job of prescribing senior centers. Senior centers are connections. It's where lives are changed. It's just where the magic happens. So I think we need to prescribe connections and prescribe senior centers.
Boy, as a marketer, that sounds like a campaign that would be a jewel in the local community.
Maybe.
If you think about it. The education of our not just our caregivers, our physicians. Andrew, last word.
It's in the same vein, I think, but we just can't emphasize enough that your voice matters, and maybe matters more now than it ever has in this country. We're at NCOA here, right next to downtown Washington, D.C., to the Capitol, to the White House, to the bureaucracy. Even though it doesn't feel that way sometimes, especially members of Congress, they are listening. We have over 120 federal policy recommendations that I believe is shared with each of you electronically. From my perspective, what I tell my team is there's no excuse. We have the recommendations, we have the stakeholder support, we have the data, we have the evidence, we know what the problem is. Now is the time to act and to really raise our voices. So I also want to put a plug in for the former Surgeon General's report that he released in 2023. The last 20-ish pages or so of that are specific things that different members of society can do to take on this issue. Whether you are a caregiver, whether you are just an individual, whether you work in education, whether you're a policymaker. It's pages and pages and pages of ideas. So we know what to do. Now we really need to get in sixth gear, this bulldozer moment, and raise our voices.
And I'm going to amplify that by saying, become the master storytellers. You are the ones that have the stories that make this all real. Tori's picture is a story in and of itself. Capture the moments, share them, whether it's in your community, whether it's cross-generational with family, with physicians, with other community leaders. Bring them forward, because you are the power that will make this real and will help folks like this who do have that opportunity to share those stories with Congress and as policy is created and all the organizations that do good around us. We can make a difference. And on this topic, one that is a little more elusive, perhaps, than some of the others specifically on the bubble, it comes back to we are a community and we have the power to bend the curve. So with that, I'm going to give you a page of resources. We'll make sure you get all of these live connections to things that you can share with your individuals in your centers and for you as practitioners. Different ideas, different things that were referred to today, and there are, of course, many, many more beyond this, but things that we can make tangible and real. I would just like to thank this glorious panel. Andrew, Megan, Tori, you're the best. But you're the real heroes. You're the ones truly that will make a difference and bend the curve. And together, I just can imagine the impact we will all have. So get proactive and keep those voices out there. Thank you so much for your time today.
Thanks so much.